You know, usually when we talk about a medical diagnosis, there's a certain expectation of precision, right?
Yeah, absolutely. Like it's a concrete thing.
Exactly. It feels a lot like engineering. Like if you take a bad fall on a ski slope and break your arm, you go to the hospital. The x-ray shows that jagged white line through the bone, and the doctor just points at the screen and says, yep, there it is.
Right, because it's entirely visible. I mean, the problem is categorized, and the solution is just a proven mechanical fix.
But if you step into the world of aesthetic dermatology right now, specifically this absolute explosion of a concept called rejuvenation, suddenly that diagnostic x-ray machine is entirely useless.
Oh, completely. It's a totally different landscape.
Yeah, it's incredibly murky. And we are talking about this massive trend of getting cosmetic procedures like Botox or dermal fillers in your 20s or 30s. And the explicit goal is preventing wrinkles before they ever actually appear.
Which is wild. And the anchor for our analysis today, for this deep dive, is a truly massive 2025 study from the European Journal of Plastic Surgery by Rahman and colleagues. They actually managed to analyze nearly 15 million social media posts regarding this trend.
15 million. That's huge.
Right. And we're also pairing their data with some incredibly pointed commentary from General Surgeon Dr. Reza Lankarani.
Yeah, and our mission today is to dissect this digital discourse, to really figure out the reality of the situation. We want to know, is prejuvenation an evidence-based medical advancement, or is it basically just a science-detached, market-driven illusion?
And we have to confront a critical reality right out of the gate here.
Oh, definitely. Dr. Reza Lankarani highlights a really important point. He says that while digital platforms are powerful tools for practice growth, they are currently dominated by unverified claims and commercial interests that prioritize engagement over patient safety.
Yeah, engagement over safety. That tension is really the core of this entire phenomenon.
I mean, it has to be. Because this shift toward prevention, it's a fundamental change in how we view medicine.
Right, because historically, aesthetic medicine was reactionary.
Exactly. A patient gets a wrinkle, a doctor treats the wrinkle. It's simple.
But in 2021, Hogan and colleagues published this conceptual review in the dermatologic literature that formally introduced prejuvenation to kind of describe this behavioral flip.
So the literature actually caught up to the trend.
Yeah, they formalized the term. Because patients no longer want to treat aging, right? They want to preempt it.
And measuring a cultural shift of that magnitude, I mean, that requires a completely different approach to research. Up until very recently, scientists were still using manual observation.
Which is so tedious.
Right. For context, there was a study in 2024 by Rothschild and colleagues, and they attempted to evaluate prejuvenation trends by manually watching and coding 74 TikTok videos.
74 out of billions.
Yeah, which in the context of global social media is almost comical.
It really is.
I mean, trying to understand a multi-billion-dollar medical trend by watching 74 videos, it's like trying to understand the entire ocean ecosystem by staring at a single fishbowl on your desk.
That's a perfect way to put it.
Whereas the Rahman study, by contrast, is the equivalent of basically draining the entire sea to examine every single organism flopping around on the sand.
Yeah, they didn't just watch 74 videos. They pulled in 14.8 million posts across TikTok, Instagram, X, VK, Reddit, and YouTube.
And didn't they pair that with survey data too?
They did, yeah. Survey data from over 15,000 respondents.
Okay, but you obviously cannot assign a team of grad students to sit there and read 15 million posts.
No, of course not. You'd be there for decades. So to process that kind of volume, the researchers deployed state-of-the-art multimodal AI.
Oh, wow.
Yeah, they use something called BERT fine-tuning alongside latent avertlet allocation, or LDA, topic modeling.
Okay, let's break that down for anyone unfamiliar with natural language processing. So BERT is a machine learning framework that doesn't just scan for keywords. Right? It reads for context.
Exactly. It understands the words in relation to all the other words in the sentence.
And then LDA acts as like a sorting mechanism.
Right. It finds the hidden thematic structures in this massive pile of unstructured text.
Think of it like taking millions of mixed up puzzle pieces and having an AI automatically sort them into distinct recognizable pictures based on subtle patterns.
That's exactly how it works. And they also utilized psycholinguistic mapping.
Wait, what does that mean in this context?
Basically, the AI wasn't just asking, hey, does this post mention filler? It was actually analyzing the emotional intent behind the vocabulary.
So it could read the tone?
Yes. It was programmed to detect sentiment, to flag promotional tone, and to check for the presence of actual scientific citations across millions of digital conversations simultaneously.
That is insane. They essentially built a supercomputer that reads social media with the critical eye of a medical board.
Pretty much. And when you filter the entire digital ocean through that kind of analytical machinery, the statistics that come out are staggering.
I bet. What did they find?
Well, 60% of all prejuvenation content online is generated by credentialed professionals or clinic marketers.
Wait, 60%? So the vast majority of this noise isn't coming from, random lifestyle influencers doing skincare routines in their bathrooms.
Yep.
It's coming from inside the medical house.
Exactly. Yet, of the posts originating from those actual practitioners, only 12% adhere to evidence-based standards.
12%. That is a massive disconnect between the credential of the person posting and the actual quality of the information.
It really is. I mean, we fully expect lay influencers to rely on sales pitches, right? And the data actually confirms that 95% of them use heavily promotional language.
Sure, they're trying to sell you something.
But the AI revealed that 68% of physicians are also leaning on promotional, sales-driven language rather than scientific objectivity.
So the doctors are sounding like the influencers.
Exactly. And to measure that shift in tone, the researchers built this novel quantification framework pitting two metrics against each other.
Okay, what are the metrics?
The Persuasive Appeal Score, or PAS, versus the Scientific Validation Index, or SVI.
Got it. So the persuasive appeal score, I'm guessing that measures the emotional hook, right? Like the subjective promises, the before and after hyperbole, basically the language designed to make you feel something.
Yeah, you nailed it. And then the Scientific Validation Index measures the presence of verifiable data, peer-reviewed citations, and objective risk disclosures.
Which you would hope would be higher for doctors.
You'd hope so. But the algorithmic reward system for choosing persuasion over science is starkly quantified in this study.
Well, I'm sure the algorithm loves a persuasion.
It does. High PAS content receives 6.2 times more engagement, meaning likes, shares, and comments, than high SVI content.
6.2 times more. But, I mean, this raises a major philosophical question about the medical profession today, because the social media algorithm operates a lot like a slot machine's variable reward schedule, right? It feeds on retention and emotional spikes.
Absolutely.
So if these algorithms inherently reward persuasion over science by a factor of 6, I have to ask, are these doctors simply adapting their communication style to survive the digital age? Or are they actively abandoning their medical oath for clicks?
That is the million-dollar question, because if a physician posts a dry, highly scientific video detailing the anatomical complication rates of dermal fillers,
The algorithm just buries it. Nobody sees it.
right, to have any reach at all, the system almost forces them to play the game.
It's a total structural trap.
It is, but the result is this landscape where the patient is left navigating a medical marketplace that is disguised as education.
And the quality of that education is terrible.
It's awful. Dr. Lankarani notes that when you evaluate procedural videos on platforms like TikTok using validated quality rating tools like the Discern score, the average video scores between 1.25 and 1.55 out of 5.
Out of 5, that's barely a 1.
Yeah, that indicates poor to very poor overall quality. The system actively punishes scientific rigor because nuance does not keep a user scrolling.
And this marketing works brilliantly because it is systematically targeting incredibly specific psychological vulnerabilities.
Oh, without a doubt.
I mean, the Raman study didn't just scrape text. Like we said, they surveyed over 15,000 individuals to understand the underlying drivers. And the data paints a very clear picture of why someone in their 20s decides to seek out medical interventions for a perfectly smooth face.
What did the survey say?
31% cited the fear of aging as their primary driver.
31%. We are looking at a demographic whose main motivator for an invasive procedure is preemptive anxiety over a completely natural biological process.
It's wild. And following closely behind that, 26% cited peer conformity.
Because everyone else is doing it.
Exactly. The sheer weight of, my friends are doing it, so I need to do it, becoming a primary medical indication is crazy. And when you combine that with the 6% who explicitly pointed to body image anxiety, you have this massive cohort of young people seeking cosmetic surgery as a treatment for psychological distress.
And this is where the 2025 systematic review from premium doctors becomes highly relevant.
Oh, right, the review on ethical concerns.
Yeah. They examined a decade of scientific literature and flagged severe ethical concerns regarding body dysmorphic disorder, or BDD, in these specific patient populations.
Because you can't just inject away dysmorphia.
Exactly. They emphasized an urgent need for mandatory psychological screening prior to these procedures, because performing an aesthetic intervention on a patient whose primary symptom is severe peer pressure or dysmorphia, it doesn't resolve the underlying distress.
It probably just makes it worse.
It often exacerbates it.
And Dr. Lankarani refers to this as ethical dilution. The line between objective professional advice and a targeted sales pitch is just blurring into oblivion. We're living through this medfluencer crisis.
Yeah, medfluencers. And it fuels downstream issues like filter dysmorphia, where a patient walks into a clinic with a heavily filtered, AI-smooth photo of themselves and literally asks a surgeon to make their physical face match their digital avatar.
That's terrifying.
It is, and the institutional blind spot regarding this issue is massive. A 2025 survey revealed that over 80% of residency programs completely lack any formal training on digital professionalism.
80%?
Yep. We train medical professionals extensively on surgical technique, facial anatomy, bedside manner, but we offer almost zero guidance on how to ethically navigate being a digital broadcaster with an audience of millions.
Think about how that plays out for you, the listener, while you're just scrolling through your phone. You see a video. The person on screen is wearing white coat scrubs. Maybe they have a stethoscope around their neck, and they're sitting in a sterile clinical room.
Right, all the visual cues of authority.
Yeah, exactly. Your brain instantly categorizes their words as objective medical advice.
Yeah.
You drop your guard because they possess those markers.
But the Raman data proves that the content you're consuming is, more often than not, highly calculated marketing. It's optimized to convert your insecurities about aging into a clinic booking.
The packaging is medical, but the intent is entirely commercial.
Exactly.
So the marketing machinery is operating at peak efficiency. We know that. But if we put down the phone and we walk into a clinic and ask for the actual longitudinal clinical data does prejuvenation actually work?
That's the real issue.
Right, like if I start freezing my forehead with neurotoxins at 25, do we have the clinical proof that I will have fewer wrinkles at 50?
Well, this brings us to the self-assessment within the Raman study itself, which is actually very transparent about its limitations.
What do they say?
The authors explicitly categorize their evidence level as not rateable.
Not rateable.
Wow. Yeah. It's a cross-sectional analysis of digital discourse. It tells us with incredible precision what people are saying online, but it possesses limited causal inference. We do not actually know if consuming these posts directly causes treatment-seeking behavior.
And by their own admission, the study has geographic and linguistic biases, right?
Yep.
It heavily skews toward English language, Western social media ecosystems.
Definitely. It's purely observational. It cannot inform a doctor on how to clinically treat a patient.
But the most glaring weakness, I mean, the giant elephant in the room here, is the total absence of clinical outcomes data.
Yep.
We have 15 million data points proving the popularity of the idea of prejuvenation, but we do not have the long-term efficacy data to back it up.
And we see this pattern consistently across the field. Take the 2025 MONOR-FRIF review, which looked at monopolar radiofrequency for dermal prejuvenation.
That's the non-invasive treatment, right?
Right. It uses electrical current to generate heat in the deep dermal layers. Theoretically, it creates a controlled thermal injury that triggers fibroblasts to produce new collagen.
Theoretically.
Theoretically. Because when researchers conducted a narrative review of the basic science, which, by the way, sits quite low on the evidence hierarchy compared to clinical trials, they found only preliminary evidence supporting that mechanism for prejuvenation.
Preliminary evidence, meaning it's not proven for long-term use.
Exactly. They explicitly called for long-term prospective studies.
Because those long-term studies simply do not exist yet. We are operating on preliminary data and theoretical mechanisms, essentially assuming that short-term tissue responses will translate into decades of wrinkle prevention.
And Dr. Lankarani highlights this disparity so clearly. When you look at aesthetic and plastic surgery compared to other surgical specialties, the proportion of level I evidence,
Which is the randomized controlled trials, the gold standard.
exactly, the gold standard of medical research, the proportion of that evidence is 5 to 8 times lower in aesthetic surgery.
5 to 8 times lower. That's a huge gap.
It is. Fewer than 1 in 5 of these promoted elective aesthetic procedures have actually undergone rigorous peer-reviewed validation for the specific long-term claims being made online.
Let me just summarize this paradox, because it is wild when you lay it all out. We have an algorithmically supercharged marketing apparatus generating billions of views.
True.
We have practitioners adopting promotional language just to survive that algorithm.
Yes.
We have young patients driven by fear and peer pressure. And we have an almost total void of long-term clinical data proving that any of this preventative intervention actually prevents anything over a 30-year timeline.
We've basically just proven that talking about it generates massive revenue.
Exactly. It's wild. The commercial drivers have completely outpaced the scientific evidence.
They really have. Prejuvenation, as it is largely practiced and promoted online today, is a commercially driven construct rather than a strictly evidence-based medical advancement.
Which places the burden of navigation entirely on the patient, which is tough.
It is. But if you are considering these procedures, Dr. Lankarani offers some highly practical advice.
And what's that?
Demand evidence over engagement. When you consult with a practitioner, bypass the iPad full of before and after photos.
Yeah, because a photo is just marketing. Lighting, angles, focal length, it can all be manipulated.
Exactly. Ask for the scientific proof. Ask for the peer-reviewed validation specific to your age group, and ask for the long-term outcomes of the procedure.
And I think returning to the fundamentals of dermatology is essential here too.
Oh, 100%. The most validated, proven method for preserving skin health does not involve a syringe or a laser.
Nope. It's the consistent application of sunscreen, maintaining a healthy lifestyle, and honestly just fostering a realistic psychological baseline regarding the inevitable biological process of human aging.
So true. We're all going to age, and the medical community really has a profound responsibility to populate these digital spaces with high-quality referenced content. The public deserves clinical reality, not an algorithmically filtered illusion.
Absolutely. And to access additional details, please refer to the Surgical Pioneering Podcast Series application available at the following link: https://lankarani.substack.com.
There's some really great information there.
Definitely check it out. But before we wrap this deep dive up, I want to leave you with one final thought to mull over. Something that builds on that massive gap in long-term clinical data we just talked about.
Oh, this should be good.
Well, think about it. We simply do not have the 30-year longitudinal studies on what happens when you start freezing and filling healthy tissue in your early 20s.
You really don't.
So what if, 10 or 20 years from now, those studies finally conclude and they reveal something entirely unexpected?
Like what?
What if constantly paralyzing young facial muscles or stretching youthful dermal layers with fillers actually accelerates certain aging processes over time through muscle atrophy or tissue fatigue?
Oh, wow. That would be a massive backfire.
Right. If the science eventually points that direction, we might currently be paying a premium to act as the ultimate uncompensated beta testers for a digital illusion. Keep that in mind the next time your feed tries to sell you a cure for an illness you don't even have yet.